Coronavirus or COVID-19 is a respiratory illness caused by a virus. Children, the elderly, pregnant women, and people with chronic illnesses are at a higher risk of getting ill. Symptoms range from a mild cough, a runny nose, fever, sore throat, and difficult breathing. Here are our 10 tips to prevent the spread of COVID-19. 1. Wash your hands. Tip 2. Social distancing. Tip 3. Avoid touching eyes, nose, and mouth. Tip 4. Don't share personal items. Tip 5. COVID-19 on surfaces. Tip 6. N95 masks. Tip 7. Maintaining distance when in public. Tip 8. Practice good hygiene. Tip 9. Self-quarantine. Tip 10. Be aware, but don't panic. UNICEF explains how we should wash our hands correctly. Step 1. Wet hands with running water. Step 2. Apply enough soap to cover wet hands. Step 3. Scrub all surfaces of the hands. Step 4. Rinse thoroughly with running water. And Step 5. Dry hands with a clean cloth or single-use towel. Remember, wash your hands for at least 20 to 30 seconds. When to wash your hands? After blowing your nose, coughing or sneezing, after visiting a public place, after touching surfaces outside of the home, before and after eating. Johns Hopkins Medicine explains social distancing as deliberately increasing the physical space between people to avoid spreading illness, and staying at least 6 feet away from other people lessens your chances of catching COVID-19. Here are a few examples of successful social distancing. Working from home instead of at the office. Closing schools or switching to online classes. Visiting loved ones by electronic devices instead of in person. Cancelling or postponing conferences and large meetings. According to the Mayo Clinic, our hands touch many surfaces and can pick up viruses from those surfaces. And once contaminated, they transfer the virus to your eyes, nose, and mouth. According to Healthline, we should not share personal items like phones, makeup, and combs. Teach children to recognize their reusable cup, straw, and other dishes for their own use only. COVID-19 lives on copper for 4 hours, steel for 2 days, plastic for 3 days, and wood and glass for 4 days. Go for cleaning solutions containing 62 to 71% ethanol alcohol, 0.5% hydrogen peroxide, or 0.1% sodium hypochlorite. The Mayo Clinic explains that the N95 mask is used to protect against potentially harmful airborne particles and are currently being used only in certain medical procedures. Current CDC guidelines state protection with face mask is enough to prevent COVID-19 when there is risk of exposure. According to the World Health Organization, in terms of social interaction, take a step back. Stay at least 1 meter distance from others. The types of personal hygiene is toilet hygiene, shower hygiene, nail hygiene, sickness hygiene, and hands hygiene. Toilet hygiene. Wash your hands after you use the restroom. Scrub with soap for 20 to 30 seconds. Rinse with warm water and dry with a clean towel. Shower hygiene. Most people will benefit from a rinse at least every other day. Showering with soap helps rinse away dead skin cells, bacteria, and oils. Nail hygiene. Trim your nails regularly to keep them short and clean. Brush under them with a nail brush or washcloth to rinse away buildup, dirt, and germs. Teeth hygiene. Caring for your teeth and gums is a smart way to prevent gum diseases and cavities. Brush at least twice a day for 2 minutes. Sickness hygiene. If you're not feeling well, you should take steps to keep from spreading germs to others. Cover your mouth and nose when sneezing. Wipe down shared surfaces with antibacterial wipes. And don't share any utensils or electronics. Hands hygiene. Germs on your hands can easily enter your body through your mouth, nose, eyes, or ears. What is the difference between home self-isolation and self-quarantine? Self-isolation is established for people who have no symptoms but have traveled in the last 14 days in regions or localities from areas affected by COVID-19. Self-quarantine. This is for all persons who do not have symptoms but who return from areas with extensive community transmission of the new coronavirus, COVID-19. The coronavirus or COVID-19 is inciting panic for a number of reasons. People are being influenced by one another and letting emotions dictate their behavior instead of taking a rational approach. How to keep calm amid a wave of panic. Stay away from social media and up-to-the-minute news. Know the facts. Actively remind yourself of reasons not to worry. Create a new routine. Live alone? Call a friend. If you have severe anxiety, seek help from a specialist. Thanks for watching. Stay safe.